Hey, good evening. This is Dr. Raj Loungani. I'm a board certified child, adolescent, adult sports and executive psychiatrist. I'm an Army veteran, and I'm here starting my introductory podcast, The Happiness of Pursuit, and in honor of May being not only Mental Health Awareness Month, but Military Appreciation Month. We want to start with some military hero interviews, and we'll be doing call-ins on Memorial Day at 222 in honor of the 22 veterans unfortunately dying by suicide every single day in America. And we'll have a moment of silence at 3 o'clock p.m. for our fallen heroes, a minute of silence rather. And today I want to start with someone who really inspired me a lot as a businessman, a veteran, just a man's man all around. This is Dr. Brenden Borrowman. And Brenden, I got to read a little bit about you because you have such an interesting background.
Thanks, man.
But Brenden, yeah, man, of course, thank you. Proud military veteran, Purple Heart recipient, entrepreneur, deployed to Afghanistan in support of Operation Enduring Freedom in 2011. After returning home from combat, Brenden saw this epidemic of mental illness and the fellow veterans just like me. That was my main reason for going to psychiatry as well, seeing all the PTSD and the vets that are deploying over and over, especially. And he co-founded ReBoot, a drug treatment center in Utah, combining physical, emotional, and cognitive therapies to address addiction and prevent relapse. And today he will tell us about his new exciting venture, Axios VR, how this new startup's looking to change how mental health treatment's done forever. And we have definitely a lot of synergy there. And that's why I'm really excited about this conversation and shape how you're going to be wanting to shape the future of virtual reality therapy as well. That I would just love to hear more about as someone who
Perfect.
loves gaming and stuff. And maybe some room for synergy between psychedelic assisted therapy, our gold standard pioneering method, and what you guys do. And that's why we clicked right away, I think, on our conference call a couple weeks ago that
Great.
our mutual friend set up. So I'm gonna first, if it's okay with you, Brenden, when I think about you and your story, it made me pull out this book I have had for a while, but I have not looked through in a while. And it's one of these great books by Damon Zaharias, the Mental Toughness Handbook. He's got so many good books for performance optimization, but this one, when I think about you, this is the first thing that comes to my mind. And in honor of you, I even wore this particular shirt, which I'll just show the audience real quick right here. One of my shirts that I had thinking about this interview, man. I was like, I got to put this shirt on for you. Not wearing my jacket today like I normally would as a psychiatrist.
That's awesome, man.
uh, yeah. And let me start with one quote from this book, or actually a couple. And let me just share this screen with you guys here. So, do you see this, Brenden? This
Yeah,
quote?
we see it.
Okay, this is the good old father of psychoanalysis. I got to as a psychiatrist and you're a psychologist as well. So gotta give a shout out. The scope Sigmund Freud, the scope of one's personality is defined by the magnitude of that problem, which is capable of driving a person out of his wits. You can think on that for a second. And then another one by the great Vince Lombardi, always one of the best coaches, listed as one of the best coaches of all time, 5 Super Bowls in the 60s with Green Bay Packers, for those of you who don't follow football history. But he always got tons of good quotes, him and John Wooden as coaches and leaders. Mental toughness is Spartanism with qualities of sacrifice, self-denial, dedication. It is fearlessness and it is love. So, Brenden, I'll turn it over to you as I come back to you. What, when you hear these quotes and think about your why, your mission, what is it?
Look, I wanna make impact before I go on the people that need it the most. I think it's our company mission as well as my mission. I guess we'll hit the road running. I have terminal cancer from burn pits in Afghanistan. For the listeners out there, my name is Brenden Borrowman. I'm a Army veteran, and now I'm a founder of a telehealth company after practicing therapies, cognitive behavior therapy and dialectic behavior therapy are the two therapies I'm certified in for about 7 years in a drug addiction clinic that I founded. I'm now taking everything I learned, trying to make it easy accessibility, scalable, and affordable, all while trying to do it while racing a clock. So I have a personal clock that I'm in a perpetual race with. And so when it comes to mental fortitude, and that toughness, Vince says it best, that Spartanism, right? So the lack of Spartan, when I think of Spartanism, I think of just, what can you do with the bare minimum? And I think a lot of people, when you're in a good headspace, think that they have a ton of resources, and people when they're in a bad headspace have minimal. When I worked with patients in the past, the one thing I think most people need to realize is we're all kind of Spartan in our capacity throughout the day. We're very minimalist of what we can handle, what we can process throughout a day. And you look at a lot of the very successful businessmen out there that their day's so regimented of what they wear. I mean, they limit the amount of active choices they have to do throughout a day so they can put all of their brain power in what actually has to be made. They don't put it in what they're going to eat or cook, or the effort of line of how they're going to dress and what their morning structure looks like, their evening structure. They're so regimented from a day-to-day perspective that it becomes body mind. That 60% of what we do is that body mind. They incorporate all those processes to body mind, that Spartan kind of mindset warrior. And I've tried to emulate that as much as possible in my personal life, to be able to focus my sole attention on what I'm building with our company and what I'm trying to do from a standpoint of impact before I go.
Thank you for sharing that with the audience about your health issue. And can you, I mean, that's hard to just walk past and go to the company. Can you tell me a little about your journey with being diagnosed with cancer, and how that impacts your sense of urgency and your
Yeah.
mission, and how you look at life, and how it's changed things for you?
So I think to tell the story right, let's start kind of with the military. So I was deployed in Afghanistan 2010, 2011. Um, while I was wounded in combat. So Purple Heart is being wounded from the enemy. It's not just being, you don't stub your toe and get a Purple Heart. It's engagement with the enemy in a complex ambush. During my time in Afghanistan, where we were at, we didn't have disposal of anything. So we burned everything from fuel, food, feces. I mean, we burned everything. If it wasn't needed, it got burned. And due to exposure to that, I, contracted a mutation in my JAK2 for primary PV. So 2015, this is after I medically retired. I got really sick. Didn't know what was going on. Went into the ER. My throat swelled shut. And after they did emergency surgery, removing my tonsils and about three inches of tissue down my throat. And when I came back from that surgery, I got notified that I had leukemia. I had AML. And so we thought it was just leukemia. I battled that, beat it with my wife. And through that process, the VA kind of gave me soft, like, oh, you have PV. Lots of people have, PV. You can get it from sleep apnea. And so I thought that's how I needed to treat it. And I was just getting progressively worse and worse. To date, I've had over 120 blood clots. I just was clotting all the time. And with PV, you get rashes and, hives. And I knew something was wrong, so I decided to go to primary or private medical care and try to figure out what was wrong with me. I went to the Huntsman Center, and through that process, I've tried everything from experimental chemo treatments to the HBOTs with hyperbaric chambers, cold water therapy. I mean, I've tried to do them all. And the one thing I've realized is if the clock's ticking, it's the same thing everybody else has. That journey of, you got to face your morality, the mortality that you have in dying. I had a breakdown in about 2017 of just feeling sorry for myself, letting it impact me. And through that, it's really funny. I went to this friend of mine that I served with house, and his grandfather was a Vietnam veteran with Agent Orange. It wasn't like he planned for me to come and interact. It was one of those things, and I'll never forget just the bluntness of so what. Like, that was his, like, I was kind of feeling sad for myself, crying, and he just jumped in our conversation. So what? Doesn't matter. Like, I could go get hit by a car today. It's like, you can get hit by a lightning strike, you can get caught in a tornado or an earthquake. He goes, who cares? At least make the most of what you know. And that innocent moment conversation kind of stoked the, like, every bedtime, I don't miss a bedtime with my kids if I'm home, right? Like it's I don't care how bad I feel, how sore I am. I'm going to go tuck my kids in. It changed the stop planning for 5 years down the road and start planning for tomorrow. What can I accomplish today that if I died today is accomplished tomorrow? And those small steps moving forward is really kind of how I found myself in the position I'm in with my business and with my PhD and everything was just tackling one small thing at a time, taking it day by day.
Man, I just gotta really congratulate you on how you are able to handle adversity so well. And I think the audience could really just we could click on that over and
Yeah.
over all hour if we wanted to. I definitely want to get into further ventures, but I just want to commend you for how you put the right attitude forward. And I think being inspired by other vets too, and about that, like the Agent Orange, how he's just like, so what? Let's keep going. That's that pick up you up by the bootstraps and drive on. And sometimes it's so hard. And what we do in mental health and psychiatry, um, I see vets every week, and it's they got that mentality, and where do you find that balance, right? Of like, hey, like what's in my control, right? Serenity prayer.
Yep.
I was in every room. I got one behind me. It's like, what's in your control here? And like for some people, it's the past is out of your control, but you could still change what you do with that next step to go toward happiness. And that's even why I named this podcast The Happiness of Pursuit, because no matter what's going on, it's like, it's about that slow growth and progress.
Yeah.
And no matter what cards you're given. And like you said, you found you were feeling sorry for yourself. And what was that process like to get out of that? Because I'm sure a lot of people in the audience also, I
Yeah.
know I have, you get down on yourself, like, and that's probably in business or life, like one of the top things I think to determine success, right? Is like your ability to stick to it, discipline, like, and get back up.
Yeah. So my process started and kind of why I even went into the drug rehab and helping other people. I wanted to heal myself. I identified that I was a broken toy. I think a lot of veterans like use the term, the army played with me, I broke and they threw me away. And the therapies that I was being given, the VA and being exposed to, just they didn't work. They weren't cutting it. There was something wrong with I felt like there was something wrong with me from a mechanical standpoint. What why can't I get better? Because all the therapies I was being given, I could not absorb. I couldn't practice them. I couldn't move forward. And you get the first stage of feeling sorry for yourself. And then for me, it turned into more of like just an anger to everything. I self-isolated. I blame myself for anything that happened in the world. And as I started like reaching out for any kind of hope and help, I started looking at like how does mental health and resiliency transition to orders of process? I wanted to know just mechanical processes. Where does this, where does it go from the book to application in the real world? What am I getting in a therapist room that I can actually apply in my real life? And I started identifying the body mind versus active mind. What we do that's just a reaction to who we are. Your heart beating, the way we just take breaths, the way we're born that way. You're slapped, you start screaming, you know how to breathe. How do those processes work? And how could I incorporate my mental resiliency into those processes? And so I started just trying to look at like, how can I change a behavior and a habit? And I came across the 144 rule. I'm sure you're familiar with this. It takes 144 days to create a habit. And I wanted that to be shorter. I was like, I don't have 144 days. When I finally like hit my point, if I could make it to tomorrow, I did a good job. And so I wanted to condense that. And I found a really cool book that's talking about people like Steve Jobs. I'll find it and send it to you so you can post a link about it. But they're essentially talking about decision making processes where Steve Jobs never picked his clothes. He had his wardrobe,
You're right.
and that wasn't an active thought. He just got dressed. He got up. It was regimented. He got up. He got in the shower. He went from the shower to brushing his teeth. He went from brushing his teeth to getting dressed. And he had
Right.
all these decision parts of the day of just the simple brain power of what shirt am I going to wear today? How many of the resources that are fixed in your brain does that pull from a critical thought process later throughout your day you might need it for? I was like, well,
Right.
if he
Kind of
can do that,
try to cut down like the decisional fatigue on things that are
yes.
meaningless so you could save it for important decisions and creativity in
I
your
mean,
thinking and so on. I think Obama did that too, maybe.
oh,
There was some thought he would
you
wear the
have
same
to.
suits over and over.
Yeah, you have to. I mean, I looked at it as I didn't have enough gas in my tank to make a good decision when I needed to throughout the day, of just pulling myself out of negative thought process. That if I could eliminate all of the gray area where I'm like, oh, this is fixed, then I could apply more there. And as I started doing that, I started realizing, looking at body mind, like I started hyper focusing on the body mind mechanics that I did every day. And so I was paying attention to how I put my clothes on. Is it left leg first, then right leg? Am I doing both, then jumping? How do I put my shoes on? How do I open a door? Is it left hand? Do I twist left, push? Just I started hyper focusing on small features, mechanics that I wasn't pertinent to before. And I started making a list of all these things. I was like, what would happen if I start doing it opposite? And so I'd pick 4 or 5 behaviors throughout the day that my body mind would want to do one way, and I was hyper focusing, I'm going to do it opposite. And what I found doing that is I was able to establish new patterns of behavior much faster than 144 days. I was doing it within 30 to 32 days. It was like the window, whatever pattern I was trying to set. And that set a ground level foundation for us moving into drug rehab, of like, how do I change an addict's brain of the point of trigger to use? How do I change that neural pathway and get them to go from trigger to use to trigger to something else, or trigger to thought process, and be able to apply whatever they were getting? And I found kind of my answers in cognitive behavior therapy and dialectic behavior therapy, because they're very regimented. They're very structured. They're not normal therapies where it's more patient level. It's like, here's your structure. This is what you'll do from point A to point B.
Those are manualized, correct?
Yeah. And so as we were doing that, I started getting the idea of there's truly got to be something with the brain here. What is it? And that's when I found Dr. Alina Fong, Dr. Mark Allen, my partners at Cognitive, and their work they were doing on blood flow restoration for traumatic brain injury. A traumatic brain injury is awesome because you can't have a traumatic brain injury and not have trauma around it. There's always emotional trauma wrapped up into a TBI, no matter what. And a lot of the symptoms are exactly the same. A lot of the expression of symptomatic from a patient standpoint, you'll see in somebody with TBI versus somebody who just has emotional trauma, it's the same symptom. And I got really interested in that. I approached them and we started looking at blood flow imbalance, first identifying blood flow imbalance of people without a traumatic brain injury, just with emotional trauma. And we kind of found our guidelines, like, here's where we're seeing overlap in trauma. And so we started, manipulating modalities of therapy to rebalance blood flow. And what we saw in the clinic is the moment we restored blood flow to these areas, the absorption of therapy went through the roof. I mean, instead of a 90-day process, we were down to 14 days. And so we were condensing treatment, we were condensing therapy. And it's not to say for the other psychiatrists out there, psychologists, we're not saying it's over. But from a functionality standpoint, of somebody being safe back on the street and being able to implement the tools you're teaching them, we saw a massive improvement in the time it took to get to the breakthrough moment. I mean, I think the average right now for rapport building is 6 months. And I'm not saying it's a personal problem. It's not the practitioner's fault, but it's the system we've built of the revolving door of 30-minute to hour-long sessions. How much rapport can you build during that time when you're trying to catch up on your caseload? You're trying to catch up with the individual. This person's in trauma. They probably already drugged themselves out of bed, put themselves in a car in a heightened state just to get to your office. I wanted to fix that kind of breakdown of the system and make it better. We did that at ReBoot, and now I've taken it to the next step with Axios. Sorry, we kind of went all over the place with that.
No, that's all good. I love going all over the place, and then we'll double click where we could get the most value. So, so many topics to discuss there. So, most importantly, I think is like the main thesis for Axios VR. Like,
Yeah.
Why this product? Because obviously, I know you've been on the road, you've been promoting it, you got funding by big funding, and you want this to be your legacy, one of your major legacies, and
Yes.
as far as the work life, and that really touched me when we were talking a couple weeks ago. Call set up by our mutual friend Chris, and you had mentioned like this will outlive me, and like I want it and. Is it every home in America? Every home that needs it? Combat veterans, non-combat veterans.
Talk on that. So
what's your vision? Because I'm a big golden circle. Your why? What's your mission? What's your vision? Personally, I think like most like vets and entrepreneurs.
So I think break it in pieces, right? So from the CEO of Axios, my vision is to completely fix the break and chain of blood flow imbalance and unoptimized neural work for therapy, the way we interact and interface with the world. I truly believe, as a nation, if not a world after COVID, even before COVID, that the mass majority of people are walking around with unhigh functioning blood flow in the brain. I think everybody has an inhibition somewhere, whether that's from childhood trauma, adult trauma, or traumatic brain injury, a car accident, bad diet. We live in a very high processed nutrition world, and there's definitely an impact on blood flow when it comes to nutrition. If you're in a highly processed diet and higher in sugar, you have a cognitive impairment. I mean, they've done multiple studies with rats and lab mice, as well as with humans, of what's the difference between a high performing cognitive individual and low performing. One of the largest common denominators was diet. And I want to make impact on that. Before I go, I would love to have Axios in every home in the globe, if not just America. I think it would fix a lot of the issues we're seeing from a societal standpoint, as well as an individual standpoint. At the beginning of this call, you brought up 22 a day for veterans. After COVID, and the new number's been published in the VA, that number's 49. The veteran population's been reduced 10% since 2020. But our suicide rate, and so the suicide rate for everybody listening is not just active suicide, but it's risk behavior death as well. So individuals that wrap their car around a tree at 160 miles an hour get put in the same bucket. That number has gone from 22 to 49 with a reduction of population. That's not just doubling, that's more than doubling the amount we had before. Our system of treatment, our system of therapy is failing. If we were doing good, we wouldn't see the increase in death. We are failing, and I think a lot of it has to do with our ego. A lot of it has to do with just not the knowledge of the tools. I mean, blood flow wasn't a conversation until about 2017. This is brand new. I mean, it's not like we've known since the 90s and we've just ignored it. I don't think our fields ignore data as it comes out. We just watch the progression. Is this real data, or has this been clinically modified to present a product? So everybody's a skeptic, I think, in our field, until we start seeing. That's why we're seeing such a long move on psychedelics, right? Everybody's a skeptic. How far is this really going to go before everybody adopts? And that's what we've seen with blood flow, in my personal opinion. But for a legacy piece, I would love to see Axios in schools. I'd love to see, when a kid starts struggling in school, they can go to the resource center and throw on a VR headset and play 15 minutes of a neuro game, get his focus back, his blood flow back to frontal lobe, and send him back to class. I think
that does sound a lot more fun than coming to a session with me
right.
or something for 30 minutes.
Abigail Schreier's book, Bad Therapy, points it out. There's plenty other clinicians. I think Duke University just published a study on it. There's something when you have limited resources like we have in our school systems. Most schools don't have an actual therapist. They have a student clinician, or they have someone that has, like myself, just a certification in cognitive behavior therapy or dialectic behavior therapy. You don't have an expert. When you don't have an expert and you get kids that are in there constantly revolving door, the easiest thing to do is just to start diagnosing ODD, ADHD, diagnose, send a referral, get to a psychiatrist, normal paper mill, here's some pills, let's see if it modifies behavior. Nothing. They don't have enough time or bandwidth to get into the mechanism of why there's an interruption. But what Axios can do is restore blood flow to a healthy state, so we can at least get the individual where they're at, to where they can actually go through the process with the counselor, whoever it may be, of identifying what the cause may be. Where right now we're just throwing assumptions. And I think that's one of our biggest failure points. We're over therapy on a child makes them kind of go down a bad route. I mean, we're seeing it all over the place, where they can be coached, not even by the individual, but just by society, into a place of belonging, because they're not optimized. They're not operating at a performance level that makes them feel like they're interfacing correctly. If that's right. If I'm throwing enough words at you.
No, I mean, I agree. I mean, when I listened to Abigail Schreier talk about bad therapy, and, she had the book before on the trans social epidemic, like, as a psychiatrist, I've definitely heard these things from parents and kids, and now some are adults, about some of these experiences. And there's definitely something going on in social media with identifying with mental health. And it's like good to reduce that stigma, but it's like finding the middle ground is like most important things, like between reducing stigma and being able to come forward and talk about it, like which we want for vets, for instance,
Yeah.
and teens who really need it. And and then people who aren't necessarily struggling as much or being told to ruminate on that and perseverate on that and wanting to identify with their depression, anxiety, or whatever identity. And that makes it very difficult. That's almost maybe an issue that's with vets sometimes with not being difficult to change the identity too. Like
Yes.
IPTSD, and sometimes maybe there is some secondary gain stuff for some people, a few, I would argue, more than a lot of doctors and people think that
Yes.
right have a resistance to getting better. But the way that VA is, that's unlikely to happen, that you would lose your benefits like that if you do get better. Like, go get better. And that's
Yeah.
why, a lot of things you said are I agree with. You at the call we had a couple weeks ago, you're like, Dr. Raj, like this, no offense, but like I'm like, no, this is why I agree with this. Like, this is actually what makes me do all the extra lifting to try to create a new model. Enhance Psych Network is to get the ideal kind of other providers, prescribers, and therapists that agree the system's broken. Like in our practice that I've had for 5 years, Enhance Psych, it it heals people and gets them better and gets them out of the system. That's why it's like the 5-star highest rated psychiatry practice in Florida and in our area in Jacksonville. And it's like, how do I get this care to the most people though? Because being a cash practice, it's out of reach for a lot of people. I can only see so many, so I got to build a network. You got to
Yeah.
be a leader and draw people to the vision of like, let's get people truly better, healed, and out of the system. Now, business people, they've said to me, because I talked to the kind of the leaders in other businesses, hey, like you want it like a subscription, like a membership where they keep coming, and it's like, first of all, we can work with a therapist and they'll be more and more, because I think we ultimately all, for the most part, want the best care, the safest care as clinicians. Uh, and do not think that they might have an issue later and there's a real trust and they come back. It happens all the time. Or you see 5, 6 people from their family to their friends.
Yep.
Like, when people call in, they're like 5, 6 people referred because there's like a trust that they know you really do want to get them better. But I think the incentive structure is totally off of like, it's a golden hamster wheel of like, just keep it going and we got to take care of family. Sometimes I think people, as a system, at least the admin people, they can kind of lose sight of healthcare can't be just like other business and cleaning business or pest control where you just monthly
I think it
recurring.
goes deeper than that too, Dr. Raj. We have to remove incentives, period, from not just a financial perspective, but from an emotional standpoint too, right? Like we're seeing a massive trend of, and let's take veterans for instance. There's a giant trend of DV, disgruntled veteran, right? It's in my best interest to embrace how broken I am and talk about how broken I am. No one wants to hear from the guy when they're suffering. No one wants to hear from the person that got better and they're like, my life's great. No one wants to, like, they want to suffer together. And we've built an incentive program from a social standpoint of, we celebrate the acknowledgement of weakness, and then we divert true growth and healing from it, and we embrace where they're at. We're just like, yeah, right, you're good enough where you are. And we see this in the body support movement. And I'm not knocking on anybody obesity or body positive or body shaming, but there's an extreme difference from being healthy in a shape to being extremely unhealthy and trying to rewrite the definition of healthy and beautiful, right? I'm not saying you're not beautiful. You might be a beautiful human being, but there is an issue of health. But we've made a social incentive to just embrace that. We've made the same thing with, the trans movement. I'm not saying that trans people don't exist. The Holland Clinic in the Netherlands have been doing studies on it for decades. It exists. It's a real thing. Do I think that giant 20% spike in youth experiencing this phenomenon is real? I don't think so. I think it goes back to an incentive structure from somebody not feeling like they have an identity or purpose. They find identity purpose in this community. They are incentivized with being applauded, and it puts them down a path line that's not going to play out in the long game. I'm terrified of this. I'm terrified of seeing it in the children. I'm terrified of seeing it in the veteran community with disgruntled veteran. There's a broken system of incentivizing the behavior because it incentivizes the private corporation behind the machine, because it keeps you coming back to your safe place, which is your clinician. It keeps you in clinic. If we cure you, you don't come back. That's lost revenue. That system is broken. And until we address it and fix it and acknowledge it for what it is, I don't think we'll see any growth come out of it. I told you on that call, I said, no offense to you, Dr. Raj, but therapists are part of the problem. Psychiatrists are part of the problem. There are great practitioners out there. And if you're one of those watching this right now, I'm not talking about you, but we can all acknowledge in our professional capacity, we know the ones that suck. We know the ones that are there to fill in their notes, prescribe some medication. I don't remember your name when you leave my office. They're the same psychiatrists that charge late fees if you're 5 minutes late to their appointment, but they'll make people sit in their waiting room for an hour because they run over because they didn't manage their time well. Or we know these people exist in this environment. Just like with law enforcement, there's always bad apples in the practice you find yourself in. Unfortunately, with our environment that we live in, with treating and like clinicians for drug addiction, let's take drug addiction for example, investors move policy before treatment because they are trying to make a profit on the clinic. If a clinician has a good idea, it's going to make people better, but it costs more money and you lose money, it's not going to get enacted. No one will roll that out. It's a bad business model. And so they shelve their ideas, and then they've put in this system. Maybe I don't think anybody goes into psych not wanting to help people. There's no reason you don't. Right. But I think you lose that spark when you've been put into the blender of machine for as long as some people have. You've been in the same career for 20 years and you don't see people getting better. You lose faith in what you're doing, in your mission, everything else, and you just become part of the system. I love clinicians like you who, our first conversation, you're like, this is why I'm doing psychedelics, because we have to break the mold. What we're doing is not working. There's not a lot of us out there saying this, because those of us that step out and start saying we need to fix the system, normally people treat us like pariahs. Why would you buck this system? Don't get back in your place. You haven't been here long enough to earn the right to speak kind of mentality. And that's where I would like to see, like, my legacy is changing that. Like I told you, this is bigger than, there's a reason it's Axios VR. Axios comes from the root meaning of, it's Roman, but the story of General Corbulo. Are you familiar with this story?
Mm-mm.
Roman general was cousin to Caesar. As he progressed, Emperor Nero came into power, and Emperor Nero had an attempt on his life by Corbulo's, I think it was his son-in-law, either it was his son or son-in-law, and he tested, like, he didn't think he was faithful. He wanted to take over. So he gave him like the worst Roman legion in the military. These are the worst ones. He made it the best. He was so threatened about his position, he ordered his legion into Rome. Do you remember the movie Gladiator? Russell Crowe?
Oh yeah, one of my favorites.
That's based, the arc is based off this individual. Emperor Nero called him to task and said, either you fall on your sword or I put your entire legion to the sword. To save his men, he pulled his own sword and said, Axios, which means I am worthy. It's not named after me. It's not Brenden Barr. It's bigger than me. This is about telling people that they as individuals are worthy of saving themselves. I was able to save myself going through it. The power of being able to do that yourself instead of you, Raj, Dr. Raj, or myself helping someone to that point, is their faith in identity is centered around the power of self-treatment, not a foundation built off of another individual. Because you build a foundation of belief off somebody else, you're bound to fail. No one can live up to your expectation of them. You treat individuals with drug addiction and they pick their spouse. The spouse is going to let them down. Pick their children, the children will let them down. They pick their parents, and till they pick themselves, they truly will not make that next benchmark. In my opinion, this is just my opinion.
Can you tell us a little bit about how the sausage is made? Like, as far as like what is the therapy that people get when they put on the VR gaming headset?
So it's functional therapy, right? So we're talking about manipulating the body with a complex task for a certain amount of time to naturally reset baseline of blood flow in the midbrain mainly. We're focused midbrain because that's where you're impacted the most, but it's an overall impact from the entire neurostructure. So when you get into our system, we have an AI engine that is monitoring everything from your interaction telemetry engagements, but also we have a wearable biofeedback decision engine that monitors your heart rate variability as well as your sleep data. The engine will take all of your entry points and it uses gameplay mechanics to capture that, and it will modify gameplay mechanics back to the person on a new build to implement the complex task with the pressure to the body to move blood flow. So if you think about it, our first product is to touch veterans. That's my community. It's your community. I want a veteran in the barracks to want to play the game. So we created a shooter game for them. It's not realistic. It has kind of a cartoony, polygraph kind of feel to it, where it's more Fortnite-ish, right? It's not hyper realism. So there's
People will
a
love that.
uncanny valley where you're not triggering people in a first-person shooter with
That's
PTSD.
good though. I did wonder about that when you
That's
when
a
you talked
risk.
about first person shooter games. I mean, we both know vets.
Yeah.
Just even hearing fireworks triggering, or I saw it in my medical units from Iowa City back when I was 18. Like the backfire on the Humvee, like that triggered it. That's what like got me down the PTSD rabbit hole and leading into
risk.
psychiatry now and psychedelic assist therapy.
Yeah, there's risk, but let's just, task force humanity. Let's say a player comes in and they have a VORX component where frontal lobe's having issue blood flow, and we can tell with a vestibular ocular reflex. The engine will see that. It'll see their engagement accuracy shooting on target, and it will change the back end data of how the engagement from the player to the AI or player to target, and it will slowly start to merge those together. So as we're training the brain, optimizing it on an accuracy standpoint, we're moving blood flow to the areas that it's lacking, or we're removing blood flow where it's hyper, where there's too much blood. So rebalancing the blood flow from a gameplay mechanic. So instead of building rapport and building trust, the state change happens within 2 minutes. Patient resistance is gone. They're just playing a video game. There's no resistance to gameplay. They're in there and they're immediately bought in. The Department of Navy did a 20-year study on mindset and state change with flow state, and they found that VR, any VR application, doesn't have to be my VR, they can put you in a state of play within 5 minutes. What we've done with our VR is we've targeted it now using sound, visual feedback, and then tactile sensation built back in with vibration. We've been able to condense that down to 2 minutes. We were just at Modern Day Marine. We had 3 retired colonels in our environment. These are some of the people that we were introduced together, Chris's team. And all of them played the same game, and all 3 of them had different outcomes of how it affected them because the engine was making it to them directly. Huge impact. We're doing a study right now. We're hoping to publish on August 1st. I truly, when we talk about revolutionizing the telehealth system, we've talked about the video game. We've also created therapy spaces for practicing clinicians like yourself, where you can go into the therapy room instead of doing Zoom like this. You have an engine that's making recommendations of therapy to you. Change the lighting, change the environment, make this interaction. Let's get blood flow moving here, so do X. It's also giving you a data feedback from a heart rate variability standpoint. So in your therapy, you say, how are you doing? You can look at historic heart rate variability, know they're not doing it, and they say, I'm fine. You can poke at them and, I know you're not fine. Let's look at your data. You haven't slept at all this week. You're sleeping like crap. What's going on? And you have tools that can help your teletherapy session move forward. Instead of, hindering the therapist with therapy, we're actually enabling the therapist for better therapy than they can get in clinic in person, because it's data driven from the engine itself, from the individual.
That's incredible. Do you feel like there'll be a place for psychedelic assisted therapy, just other CBT, cognitive behavioral therapy, psychodynamic therapy, family therapy, like along with it? Is that how you guys have tested it or how you envision it?
So let's again, this is founder vision. So don't come with your pitchforks at me, because it doesn't exist today. I would love to see Buddy, our biodynamic decision engine, our AI engine, become and morph into, with AI, where AI is moving with interactions. We're probably a year away from it being uncanny, but where you won't be able to differentiate between an AI generated NPC or a human controlled NPC. You just won't be able to differentiate. Through training models, we've already patented our engine system. We're training it now. I would love for our AI to conduct cognitive behavior therapy, family therapy, from a vocal interaction standpoint in VR, on top of all the data fed. So that way it's an AI engine giving you the therapy you as an individual need based off of your data. So instead of making assumptions like we do in clinic, where we have to fill in the blanks that we're not getting to kind of complete the story from a patient, AI will do that with the patient.
I'm going to show people your website while you're talking about it.
Yeah. So I'm hoping that and this is vision. I'm hoping that we can duplicate what a really good therapist does. And this is where we talk about scalability and affordability. We should be able to replicate the therapy and quality therapy you get in clinic with AI. That's vision down the road. Right now, I want to support and enable therapists to conduct better therapy. Instead of doing the guessing game, let's take the guessing game out and feed data into that decision process of how to treat your patient. That is what we're doing now. Where we're moving to in the future is completely replacing it. You brought up psychedelics, which I love as an immediate life-saving mechanism. It's a roll one. How do you stop an arterial bleed immediately? You see down there on our Instagram, one of our patients was wearing it after coming out of surgery, and put him right to sleep. Psychedelics, in my opinion, artificially move blood flow to a healthy baseline.
That's my jam.
That's your jam. Yeah, that moves blood flow to a healthy baseline. There's been plenty of studies and imaging done on this. It helps the individual have an optimized blood flow for absorption. So when you're doing therapy with somebody under the effects of it, they're absorbing more of it, and they truly absorb more of it, I believe, because of a neural function. The capability of neural function when you're under the effects of psychedelics is massively improved than when you're on pharmaceuticals or when you're in therapy for long, like, inpatient stay. That individual is not absorbing the modalities of therapy you're giving them. They're actively resisting it because they don't want to be in the hospital. So when you're conducting psychedelic treatment and therapies, you're able to get somebody to a high functioning standpoint from a functionality perspective. But there's also when your blood flows in that state because of the medication, some people call it spiritual, some people just call it awakening, but there's an enlightenment period that happens during that phase where you have about a 2-hour window on average where you can really help shape that individual's narrative of trauma. So you can identify trauma and you can reshape the identified trauma in that 2-hour window. Once that window is gone, it's gone until you reintroduce the psychedelic after you've had a period to kind of come off of it and be sterile for a bit. So it has a larger impact. The blood flow mechanism has a half-life. It goes back to the damaged state without getting a healthy baseline reintroduced. After a couple weeks, they revert back to where they were at before damage, and you see a drop-off of efficacy of treatment. I love psychedelics for an immediate. We have someone that's suicidal. We have somebody in critical care. Let's get to them right now and stabilize them. I believe that psychedelics will become just like all of our antipsychotic medication, where it's supposed to be very short. You read any of them, it's short-term use, 6 to 12 months. Then people end up on them for 10 years. I think that's the risk with psychedelics, is that we're going to see such a massive efficacy impact on the population that people are going to become, it's going to become a crutch. People are like, I have to do my ayahuasca every 4 weeks. Every 4 weeks I'm doing a ceremony. I feel great. I'm accomplishing the world. I want to get people from a neural function standpoint, after they've played our environment and we set a new baseline, which right now the studies are showing our progress scans an hour a day for 4 days to establish new baselines. So I'm not saying you had to play a game every day for a year. It's not much. It's 4 days, an hour a day. I would love to see people use psychedelics, a program like ours, restoring blood flow healthy, to where 6 months later they're saying, oh, something happened and I took care of it. You shouldn't have this constant revolving wheel of patient care because you are their space. They should graduate and move forward with their lives and go forth and conquer. I mean, that's the goal for every human, right? Your podcast, right? The happiness of pursuit. They should be able to pursue that happiness because from a functionality standpoint, they've recovered enough to where they are now in the driver's seat, controlling their response and reactions to stimulation in their environment.
Absolutely. And I think, I was listening to Jocko on a recent interview, and he talked about like remembering, not dwelling. And he was talking about his comrades he had lost in Fallujah. And I think a lot of people that we've seen, and maybe yourself from your overseas trips and other things, have trauma that you can get stuck in. And talking about it in trauma-focused cognitive behavioral therapy or other kind of trauma-focused therapies at the VA or elsewhere is very difficult. Like, part of PTSD is avoidance. And that was one of the things that really led me to get into psychedelic assisted therapy. Right now in Florida, we have ketamine legal. People, will go do ayahuasca or microdose psilocybin or LSD. And some will have really okay or good results, and some will have not so good results when they do it on their own like that. So what we wanted to do was to provide like the medical oversight and I'm trained in psychoanalytic psychodynamic therapy from New York in my residency training at NYU.
Yeah.
And this is really like plays to that because we're going into unconscious and it gets, like you said, spiritual enlightenment, mystical kind of therapy, which is those are the therapists that we really love working with the most as far as like being able to provide the psychodynamic therapy that goes with psychedelic assisted therapy. And we're really trying to heal the trauma while the person is in their vision, so to speak, with the ketamine. It's a dissociation. But with the MDMA likely getting approved later this year, by next year, it's up for FDA approval. MDMA assisted therapy, not just the MDA drug itself. It's not even a patented drug. These drugs have been, as you know, around 50 years. They've been illegal, but they were some, psychiatrists and psychologists that had found that they were useful and helpful in therapy before that. It just they started becoming drugs of abuse and politics and so on takes over and they become illegal. But the results that were in Nature Medicine published there, like in the last year, showed MDMA assisted therapy. So people with moderate to severe PTSD, 90% got better, at least 20% more than placebo without the MD basis therapy treatment as usual. So it was so powerful. And now that we have military veterans and power and committees in Congress and so on, they were kind of speaking up for it. So I think it has a good chance. And my sources say even psychedelic assisted therapy by next year, psilocybin. So this $500 million field of psychedelic therapy might go 10x to like, 5 billion over the
Oh yeah.
next 5 years. And so we're really trying to be in the forefront of it because being in North Florida, kind of conservative area, I've heard things like drug dealing because they think these are drugs of abuse. They're illegal drugs. That's how they know of them, right? From K, special
Yep.
K, and K holes to MDMA. Of course, it's ecstasy, Molly to as a rave drug, and then psilocybin mushrooms, magic mushrooms. And they're
Yeah.
thinking back in the 60s when they did kind of screw it up a little bit, like just like some other drugs that come along with opioids and marijuana, like the greed kind of takes over. And if it's just out there in the public, just use it willy nilly, it could happen where the wrong people are using it too much. And so you had like people just stop showing at work, they get almost like half baked with the psychedelic, doing too much of it. And so the idea I had is like, look, we need providers that are really proven to be good providers, good prescribers, good therapists out there as thought leaders on it. And that's even a big reason for creating this podcast because I was wanting to draw in the best talent
Yeah.
is a funnel and people drawn to the same vision of like my smartest patients, they were stable with medication. They were stable even doing every other week or weekly therapy as far as like not having significant depression or anxiety or PTSD overtly, but they would
Yep.
still hadn't learned the lessons. Alex Hormozy talks about behavior change is learning. Like if you don't change your behavior, you didn't learn. So like not from lack of trying, but they didn't totally get to process and go all the way through the tunnel of their traumas just with talk therapy, with suppressing symptoms, with the you know, antidepressants and the antipsychotics and the mood stabilizers. Like it suppressed symptoms, but we need a real healing. We need a real thriving. There's a mental health crisis. Too many people need help. We gotta it's a typical business principle that better is more. Like you will not lose, in my view, in the long run, the infinite game of just doing better care, safer care. Because there's
Yep.
a lot of companies coming along and they're kind of trying to make a buck a little bit and trying to do some good, but they're not doing it with the science the best it could be. So where we have synergy is the most IV or most ketamine, I'm sorry, providers are doing like IV ketamine clinics. And so it'll only work, like you said, for a certain amount of time. It'll allow the malleability on behavior and change of thought
We're
patterns.
we're doing a study right now with ketamine in the clinic here in Provo.
Uh-huh.
Diane Springer is running that. And it's more for like our really manic depressive clients that blood
Sure.
flow integration is not getting them over the hump. And one of the
Right.
things we're
So,
looking at is creating a virtual environment to where it guides them visually while you're stimulation of a therapist in the room with you while you're going through your treatment. So not only do you have your therapy experience with them, but from a visual perspective, you can control their journey. So if we want them to go
interesting.
down a certain road, we can visually stimulate that growth path with VR on the ketamine experience
Ah.
and you as a clinician. So this is where when we talked a couple weeks ago, I was like, we got that call. I was like, there's so much we can do with Raj from this perspective, because you're right. There is the issue with these drugs from the street level is it's a tool, and any
Yep.
tool can be used for destruction, right? You can build a
Absolutely.
nuclear bomb, or you can build a nuclear power plant for clean energy. I mean, it's the tool is the tool. And in a clinician's hat, I think there's massive growth that can be done. Is there room for abuse? 100%. We've seen it over the decades. I mean, you were talking about yourself, K-holes were like people get the K-hole nod where they're out in public and they're just passed out. It's because they've gone down a rabbit hole. They've taken too much. They like the beginning, how it felt at the beginning, and then the high takes over. And you're seeing that now with the drugs coming across with fentanyl across our border. People are willingly on the street using. That's the need of our population, is people are willingly killing themselves because of the high and the feeling they get for that brief moment on the drug, versus going and fixing the trauma that leads to everything else sucking. And that's
Right.
I don't know
Correct.
how we
And
address
that's what
that.
we really wanted to do, like, which was so, like, I mean, and the psychedelics have almost like mystical, I don't want to say magical, but people say, like, how did I become less patient for the next week after? Like, that was my intention going in. It felt like I rubbed the lamp and got a genie, when I told my
Yeah.
intention, it happens. And it's like, we say, like, you will get your goal, like, careful what you wish for kind of thing. Like, you will get this goal, but it may not be the way you think. They'll have to go through traumas that they didn't even remember they repressed, or those were in front of mind, at least, of what they thought were the things that were the most getting in their way. But people will go through it while they're having the therapy, and we will then, like, integrate those lessons they get into their life, and you will see, like, changes in the relationships. They recognize love and connection is the main thing and what it's all about from the psychedelic, which you kind of brought up with the mystical experience, the spiritual experience people can have, but also this malleability factor, like to be able to make change on your thought patterns and your behaviors. That's huge. So now that leaves room for where there's synergy with other great therapies, which is where I could see it really being probably your way that you said as well, where you do it during. But I feel like often people are going into the vision, like listening to the music therapy, have an eye mask just going inward. They're touching into often that trauma, but like in the next 3 days, especially they get more from EMDR or internal family
Yep.
systems or other trauma therapies, even just traditional cognitive behavioral therapy, family therapy. Like sometimes we'll do therapy with a couple because it'll help their relationship because they recognize the love and they're more patient and they're more aware. And but you now put this VR headset, I could see within the next couple of days on, especially every day. If it's like every day, like for you said up to 4 days a week, you could be now getting even more from
It's all
that
about neuro
experience and the therapy.
optimization. It's all
Yeah.
about that neuro optimization. How do we optimize your engine to work as best as possible? Most people are, they're a 12-cylinder race car with one cylinder working. It's not their fault
Yeah.
they're not crossing the finish line.
That's a good analogy. Do you think that there's like with psychedelics, like you said, like that difference again, I think a lot of providers might just provide over and over like the broken system we talked about. I
Yeah.
say I limit it. Even when people want to, I limit it. Like we're gonna do only up to 6 and we'll reevaluate in the future because there could be long-term consequences
Well, that's
and more is
Pandora's
not better.
box.
It's more about the integration. It's more about the integration. And we've only healed and there's lasting results even when we check the scales 6 months later without doing it.
Yes.
So that's kind of more the method Enhance Psych Network created was more about doing it up to 6 weeks and just getting a very acute, accelerated, amazing treatment to heal. Is there any negative that could happen with too much Axios VR?
So blood flow reintegration, there's no negative. The negative would be the social component, right? Like any video game, there could be I feel so good doing this that I'm going to do it all the time. And it comes back to the tool, the process. We have a video game. If someone's spending 8 hours a day in a video game, it's probably not good for you. On any platform or any
Yep.
video game,
Everything in moderation, including
yeah,
moderation.
it comes down to I can control from levers on my side of how much exposure you can get with recommended playtime. Hey, you've been in here for 2 hours. Maybe you should take a break, right? We can set guidelines. My concern is with all of this Pandora's box. If psychedelics become FDA approved, how long does it take before big money goes, oh, we can make more money doing this? Because now people have an object to chase, and you become a clinic drug dealer versus a clinician where you do treatment. Without clinics like yours setting standards and saying, hey, this is the appropriate term of treatment. This is the appropriate, until processes are established by clinics doing it the right way, like your clinic, I'm terrified of what just opening it up looks like. Because we both know there are doctors out there that are going to go to an investor and say, hey, we can get people hooked on our clinic where they're coming in 4 or 5 times a week to get, ketamine drips or MDMA. And, they feel great while they're in here, and that becomes a new habit. We can put them on a subscription plan, and, they can be part of the membership where they come in and use, and then we throw them in a sauna and they leave. Those businesses will pop up, and they're very pariah in nature. Think of like what's the new ones with the chiropractor practice with cold therapy, the cryo freezes, right?
Oh, okay.
It's a $4,000
Beyond a cold, like or cold plunge. Okay, got you.
Yeah, like they buy this machine for $4,000. You go into your chiropractor, he pops your back, he throws you in a cold machine, and then you leave and you feel great. And you're like, oh, I'm going to go back, and all of a sudden you're set up for a $300 a month subscription, and you're going to get your back popped. And I'm not knocking on the practice. It's just I do not believe that people are seeing the actual medical efficacy that they claim. You're in a strip mall next to Domino's. You know what I mean? You're not in a hospital. It's dangerous to tell people you can change their life by utilizing cold temperature and cracking their back, but they exist.
Right.
These
How
clinics are out
long,
there.
Brenden, how long do you think it'll be perhaps before vets through the VA or people at home could have a VR headset? What are you
So
guys anticipating?
we're commercially releasing next year for everybody
Perfect.
to buy at their homes. We were just at Modern Day Marine and the comment out of the Marine Corps, Sergeant Major Marine Corps, stated every Marine that they have needs a headset. We're partnering with a giant manufacturer right now, hardware manufacturer. We already have an Army pilot on the books. Like it's coming much faster than I think most people are comfortable with, but that's the world we live in now with AI. It's a new battlefield. It's the way of the future. The first person to develop the right engine to train the AI is going to win. And that's how they view what we're doing in mental health, because just what I'm creating can help you. If it's, being created by bad intentions, it could debilitate most of our society. Look how TikTok was built and the effects it has on the psychology of our youth with attention deficit disorders. It's insane. So that's where we're at. That's my legacy piece. I want to do it right. I want to do it fast, and I want to make sure it's impacting humanity from a beneficial standpoint. If it's ever taken away, then we're going to kill it.
Yeah. Brenden, tough question. But when you talk about legacy, like did your doctors, what are they telling you about your prognosis? Like as far
2 to
as
3 years.
Oh.
So,
Man.
good thing I'm working in AI. It moves quick. Hopefully
The
I'll be
world
able
will
to
be completely changed by then. And I'm like, again, just commend you so much on your attitude. Just that it sounds like you always carry that attitude of gratitude and just mental toughness. And I gotta ask you about the doctor, your chief medical officer, real quick.
Yeah.
Man, like because he had got back to me. I wanted to hear a little more than the white papers on the research. And he's just most of us docs, we're pretty, we're vanilla, pretty basic. I want some corny, but your doctor that works for you, not so much. Could you tell us a little about him? Because I
Let's
really want
talk
to get to know
Mark.
this. I want to really get to know Mark a
Yeah,
little
go
bit, and
ahead.
I'll show the
Take
audience some of
leadership
his
up there.
pictures because he's a different cat especially for doctors.
So Dr. Marco Grifa is our chief medical officer. He is a NASA aquanaut. He is training right now to be selected. He's hoping to go to the moon. When he is not being a NASA doctor, I guess let's expand upon NASA. So Mark led the first Irish mission on the International Space Station with heart rate variability. So when we talk about heart rate variability and what we're doing with our technology, Mark essentially wrote the book on it. It was the first mission on the International Space Station tracking sleep studies, the impact of sleep, and heart rate variability. Mark had then moved into he's an MD, but he's also a biomechanical engineer. So he holds 2 doctorates because he's an overachiever. Mark, if you're watching this, And he went into some startups, but our president and co-founder Craig Cooper was a fire chief in Vegas. During COVID, they
Mm-hmm.
set up the nation's largest field hospital. Mark is still running that field hospital right now. It's where he's actively practicing. When he's not doing that, Mark is training for NASA, or he's jumping out of planes with special forces because he does special operations medicine. Um, yeah, he's a diver. I mean, he spent time at Nemo. The man does extreme to a whole nother level. He makes me feel
Shout
inadequate.
out to you,
I'm
Mark.
in conversation. So
Man,
Mark,
because he's been in tech, he's been in the Valley with different companies, he's been NASA, like that's a different kind of cat.
yeah, Mark's built different, is what we like to say.
Man, Brenden, is there anything else you'd like the audience to know that we haven't already talked about? And then I'll maybe finish up with you because I know you got to go. You got a flight to
Yeah,
like Tampa, right? You got a
I
special
gotta I
forces
gotta get
meeting.
ready to fly out to Tampa. Yeah, we're
Sorry if
going
I
out for
wasn't allowed to say
soft.
that.
Oh, you're good. It's fine.
CENTCOM.
It'll be over by the time this comes out. So yeah, we'll be in Tampa for Soft Week. Super excited to meet some of the folks out there. I think that what I like to end all these with, disclosure wise, if you're watching this or if somebody has sent this to you and you're struggling, I think Dr. Raj can agree with me on this. I want you to know it is not your fault. There, from a functionality standpoint, if you're struggling with addiction, you're struggling with depression, anxiety, PTSD, it's not something that you can just will yourself out of. From a fundamental standpoint, you most likely are dealing with a blood flow imbalance. You're fighting a fight with your hands tied behind your back. I don't want you to feel like there's no hope. It's very easy to get in that mindset of it's a you problem. And I hope anybody that's watching this is at that point in their life or is impacted and you're feeling suicidal or struggling to reach out immediately to people in your network or your local ER, get some help. You can't do this alone. This is not something that you can kind of just will and with willpower pull yourself out of the hole you may be in. Please reach out for help. I'm sure Dr. Raj has a link to contact his clinic. If you're watching this on LinkedIn or social media, I'm tagged in it. You can always reach out to me. But Dr. Raj and his clinic are doing amazing things. I fully endorse what they're doing. And I'm honored to be here. Thank you, Raj,
Thank
for
you.
having me on it.
Thank
Yeah.
you. Brenden, where can people find you?
Find us on Instagram at Axios VR, axiosvr.com, or on LinkedIn, Axios VR. We don't do much Facebook. I guess we should probably do better at that. And then me personally, you can find me on Instagram at ReBoot Brenden. Yeah, that's where you guys can find me, or Brenden at
We'll
axiosvr.com as
throw
well.
those in the show notes for sure. And Brenden, I just want to again commend you for everything you're doing. I wanted you to be my first inaugural guest because,
I'm
and it's
honored.
such an honor to have you because when I talked to you, I was like, this dude's different. You're an inspiration to me and the world. To get a terminal diagnosis and you're still family oriented, mission oriented, the consummate soldier, always. And you have a big mission to help serve the world. And man, I just can't thank you enough for coming, for sharing your story with us. And I know Axios VR, I will do whatever it takes to help make it go wherever it needs to go and test it and make sure it's used in the best way possible to help the world.
Thank you.
And I know it'll be an amazing legacy. And man, like sometimes there's things out of our control that we can't necessarily change. We have to have serenity for, but I feel like overall, there's always more you can control. Like you can always change your attitude. You can always change your behavior, how you respond to crisis or adversity or challenges can become opportunities. Like you said, you turned up yourself as a father. Like I'm gonna even more make sure I'm there every night for bedtime stories. And I'm sure for your wife as well. I'm sure for work, like you're like go, go, go because you're like, hey, time is not forever. And like I think we all can learn something from that example. Because sometimes I
Well,
feel like time will goes forever and it is just not the case.
I got really lucky. I got a beautiful, amazing wife. She's German, so They're built different too.
Stoic,
They're
like
very
you guys you're
very stoic.
good
We do
compatibility.
not hugs. I'm just kidding. That's a joke. But no, I got very blessed that I have the partner that I do to go through all this with, and who takes care of many of the things. When we talk about your daily structure, not having to worry about things, so you can use brain power for other things. My wife takes care of while working full time, while building this business with me, takes care of so much of the mundane, where I don't have to put brain power into it, to fully put my brain power into what we're doing here at Axios. And I couldn't be more blessed with the support system I have in my life. And I'm looking forward to Raj doing more with Axios. For your viewers out there, Raj will be here hopefully in the next 6-7 months, conducting his own studies with the Axios platform and what they do. As we get through our
Absolutely.
first study we're doing now, just honored. Thank you for letting me be your first guest. And for everybody out there viewing this, if you need help, please reach out. I'm sure Raj is going to have a link to his clinic. If you truly need help, please reach out to this man and get it, because there's not a lot of good places to go. And Raj runs a clinic that is an actual good one.
Thanks, Brennan. I wanted to try to create a tradition. I love the idea of having a thread between those different interviews, because I'm going to talk to another military hero later. My assistant's father is a Navy submarine nuclear specialist, and
Oh, wow.
very fascinating. So, I wanted you to maybe leave him a question, if that's possible, and also I'll since you're the first, I'll just give you one that that's come to my mind talking to you, is because it'd be easy to say what's next. I think we've already kind of covered what's next for you, but what is the toughest moment of your life, and how did you pivot from that and respond to that the best, and to get to where you are now? What did you learn from that moment?
Toughest moment for my life was probably waking up in Germany after being wounded in combat, and finding out friends were dead. I survived. And the loss of identity of knowing that my time, I always, from birth, I wanted to be a soldier. I mean, you can go back and look at Halloween costumes. I dressed up as army men, but I didn't chase it like I should have. I let bad decisions and hard childhood kind of force me into, that was like what I thought was my only option. And I got really blessed finding that identity, but it got taken away in a moment. And I think a lot of veterans watching this, that might relate to that, is that pivotal moment of no longer being a soldier and trying to figure out what I want to do in life, was probably still to this day the hardest thing I ever had to do, because I couldn't envision myself doing anything but that. And I think moving through that process of acceptance, you have to accept that's no longer your identity, and that, we want to grab onto. I went and contracted, any straw I could grab to still feel like a soldier. The moment I let it all go is the moment my life changed for the better. The moment I allowed the book not to be about being a soldier, but it being a chapter in the book, and going, okay, what's next? What am I going to fill the next chapter with? That freedom that came with that is something that I don't think you can coach somebody into. You find it naturally through progression. Unfortunately, some people, it takes years to find it. I got lucky and only took 3. Yeah, I think that's the hardest moment, how I moved through it. Just having to live life, being forced to live life. If I didn't have young kids, I probably wouldn't have been able to do it the way I did. Having my children, and that blessing of dependency upon me figuring it out, forced me to move forward.
And it's incredible. And I am definitely that transition between military and post-military, just like pro athletes talk about, just the change in identity, a lot of the structure. As hard as it is in the field overseas, you hear people say they want, even when they're wounded, it's amazing how courageous people are and mission oriented. They want to go back. That's for their comrades, for their brothers and sisters.
I
And
loved it.
it's also just, yeah, because the people outside the military, I think it'd be hard for them they might say, oh, that's Stockholm syndrome or something, but it's they don't understand how much we love our country, and we want to serve it, even, regardless of the policy, if we agree it personally or not. It's we're there doing it for brothers and sisters,
Yes.
and there's a mission, and the stakes are so high. I mean, business, the stakes can seem high, but nothing compared to making the
Nothing.
decision, the field, life or death.
I would love, so real quick before we end this, to speak on that. I
Absolutely.
think it's important for people to understand, when you hear veterans like myself or yourself to talk about the desire to be back. I don't miss the firefights. I don't miss the battle. I don't miss that. But what I do miss is an understanding of care that I had with my fellow soldiers, the brothers, sisters. Everybody assumes that everybody in a platoon loves each other. That's not the case. I deployed with guys that I absolutely hated. But the thing that we had in common is that I knew when the round started flying, no matter what, that guy to my right would risk his life to save mine. Regardless if we agreed on politics, regardless if we agreed on sports, regardless if we even liked each other, when the moment happened, I knew he would give his life for me and I would give my life for him. And that sense of community and that understanding of true consequence of action, it's, you can't get more primal than war. The ability that a man has to destroy another man is not ever, you can never conceptualize that in a book. You can't conceptualize it in a movie. That it, until you live that moment, you will never truly know what that is. And with the ugliness of that, there's still beauty that someone that I might not like at all is willing to die for me. You don't get that in the real world. You don't get that in business. You don't get that with family. You don't get that. You might get it with your spouse or your kids if you ever have a horrible trauma situation like a home invasion, but your day-to-day bubble we live in America, you don't get that. And so when people hear like a soldier be like, I love it, I want to go back, I think the first judgment is like, why do you want to go back to war? That's crazy. I truly personally don't believe it's the war. I think it's that camaraderie. It's that you will die for me regardless, and I will die for you regardless, because we have one mission here, and the mission is to stay alive. And
Absolutely. Totally.
that for me is, I think, the thing that stands out the most from my military career, and the thing that I struggled with the most is when I got out, I never found that replacement looking for a community or culture. And that was part of the hard part with the identity. And it wasn't until I cultivated that culture in my own companies. This goes to your business people following. Culture starts at the top, but it also starts in pockets. You might not be able to change your entire company structure, but if you're a manager and you're in charge of 3 people, you can start that culture with 3 people. It might not go anywhere in that company, but one of those 3 might go to another company and start it there. It will spread eventually. Maybe
Be the change, like Gandhi said, be the change you want to see, and you never know. Like start with change yourself.
Yes.
Take like extreme ownership, change yourself, and people will follow your example off. And then it's not always the loudness of the message. It's leading by example, and you definitely do that, Brenden.
Thank you.
It's such an honor to have you, Brenden Bowerman, everyone. And I just want to leave with a message there on love. We talk about the thread throughout: love, loyalty, mental toughness. You never know what other people are going through. So be kind to each other, be kind to others, be kind to yourself. You're worth it. And Brenden, thank you so much again. And please send over a question for our next guest if you don't mind, and we can keep that thread going. Text me one later.
Yeah, I'll text you later. I'm going to give it a lot of thought.
Thank you, my friend. And good luck today at your trip. To say hi to Chris for us, our mutual friend, in Tampa when you go Special Forces. See the Special Forces guys there. And Brenden Bowerman, everyone. Thank you very much.
Thank you.